In today's video, I want to teach you about how inflammation amplifies pain and how reducing your overall systemic inflammation can be super helpful in reducing aches and pains. Hi, I'm Dr. Jesse Morris. I specialize in both chiropractic and functional medicine. As a chiropractor, pain is one of the main reasons people come to see me. So when it comes to treating pain, physically working on the body can be super helpful, right? Improving range of motion, relieving tension. But there are times when somebody's body is just so inflamed that the inflammation actually limits how effective the hands-on work can be. In those cases, giving somebody some anti-inflammatory support can be really helpful in reducing overall pain and symptoms. So I want to teach you about how inflammation amplifies pain and some simple things you can do to reduce your overall levels of inflammation. So when you have an injury, right, you've injured some part of your body, there are nerves called nociceptors that carry information about the injury up to your brain, right? They inform your brain about the levels of tissue damage in the body. But when you have an injury, you also have an inflammatory response. And part of that response is the production of these chemicals called cytokines. Now, cytokines can stimulate nociceptors and kind of amplify their signal of the injury up to the brain. Now, a great analogy of this, or an example of this, is a sunburn, right? If you're like cruising down the road, arm out the window, and one arm gets sunburnt, right? If you touch the non-sunburnt arm, feels normal, feels like a normal arm. If you touch the sunburnt arm, even though there's minimal tissue damage, it can be pretty painful because the inflammation is amplifying the signal from those nociceptors up to the brain. So if you're dealing with pain, reducing your overall levels of inflammation can be super helpful. But how do you do that? So a helpful analogy of this is to think of inflammation like a fire, okay? If you have this raging campfire and you want to put it out, there's a couple things you need to do. First off, you need to stop adding fuel to the fire, okay? And secondly, you might want to dump a big bucket of water on there and really douse it and get it put out, right? So where's the fire in the body, right? Where's the biggest source of inflammation in our body? Most often it's coming from the gut, right? So how do we put out the fire in the gut? So first thing we need to do is stop adding fuel to the fire. The fuel, when it comes to inflammation in the gut, are inflammatory foods, right? So the top of the list are gluten, dairy, and sugar, right? Those are the biggest foods that really drive inflammation in the body. But what else, right? There are others. So processed foods in general, so anything highly sugared, highly sweetened, or salty and crunchy that comes wrapped up in a nice little plastic package, it's probably going to be pretty inflammatory. Fried foods tend to be pretty inflammatory, and then refined grains, right? Refined carbs. There are others, there's a big old list of inflammatory foods, but those are kind of the top of the list. So removing gluten, dairy, and sugar, getting processed foods out of your diet, less fried foods, less refined carbs, that can go a long ways towards reducing overall inflammation. So we got to take the fuel off the fire, right? And then douse it and put it out. When it comes to dousing inflammation, I recommend a combination of anti-inflammatory supplements. The top 3 on my list are omega-3s, curcumin, and resveratrol. But when it comes to anti-inflammatory supplements, you need to take them at a high enough dose to get an anti-inflammatory effect, right? If you have a shot glass of water and you dump it on a campfire, it's not going to do much, right? You need a bucket of water. So with omegas, you need somewhere between 1,300 and 1,500 milligrams of EPA per day. Okay, if you look on the back of any fish oil supplement, there's going to be a combination of EPA and DHA. You need to look at how much EPA is in each capsule and add that up till you get to that 1,300 to 1,500 milligram dosage. With curcumin, you need somewhere between 700 and 1,000 milligrams of curcuminoids per day, and with resveratrol, you need somewhere around 500 milligrams per day. So if you're experiencing pain, right, reducing your overall levels of inflammation can be really helpful, right? Some really key ways to do that are removing inflammatory foods from your diet, right, or reducing them, and then adding on some anti-inflammatory support just to get the overall levels of cytokines to come down, and so those cytokines stop amplifying the signals of pain that are coming from your body to your brain. So listen, I hope this is really helpful. I hope this gives you some insight and some tools to work on to reduce your inflammation and reduce your pain. Thanks for taking a few minutes to watch this. I look forward to seeing you real soon.